Here.
Ms. Brush. Dr. Kemp.
Here.
Mr. Sischler.
Okay, so we do have a quorum. So the first item on the agenda is to discuss the South Webster Branch Library building repair. And to do that, we're going to need to go into executive session. Do I have a motion to go into executive session?
This is
Ryan,
Tammy. I
so
move we go into executive session.
Make the motion, and Ryan, did you second that?
That's fine. Yep.
Okay, can I have a roll call, please?
Yes. Mrs. Morton.
Yes.
Mrs. Tiemann.
Yes.
Mr. Sammons.
Yes.
Dr. Clay. Mr. Clay.
Yes.
Dr. Kemp.
Yes.
Okay.
So we're entering executive session at 12:06 p.m.
Oh, okay, so let Okay, we're good to go.
So we're out of executive
Okay,
session.
so we are back out of executive session. So do I have a motion from that? Can I get someone to make the motion to what we discussed?
Yes, we need to, I move that we contact Danielle Parker to propose or to put together a letter to send, whatever it's supposed to say.
To the contract. Yeah.
Basically, a written notice of defective
Faulty
work
stonework.
to SCI. Okay.
Yes,
Yeah.
thank you, Kara.
You're welcome. I'm Ryan. I have a motion from Tammy. Do I have a second?
Ryan seconds.
Okay.
Third person.
Can I get a roll call, please?
Yes. Mrs. Morton,
Yes.
Mrs. Keeman,
Yes.
Mr. Sammons,
Yes.
Mr. Clay,
Yes.
Dr. Kemp.
Yes.
Okay, the next item is health insurance. Paige, you're probably gonna have to help me on this. I think we have, do we need to be looking at the email where it says Anthem 2021 renewal? Is that what we need to look at?
Right. Anthem came back and we had a 14% increase, and usually they can go back and work with them. There is no going back. Usually if we agree not to shop around, but they didn't do that this year. The problem was, normally the insurance company likes to get a ratio of, cost under 1%, or at least 1% to where they're breaking even. With us, they hit 1.7%, so they actually lost a lot of money on us this year. So that is the reason for the 14%. So the if you have the sheet in front of you, that's like a large spreadsheet that has got different colors on it. You'll see some of the different costs. Right now, if we would keep it as it was with the staff only paying the 7.5 part of their premium and families or dependent coverage 32.5, and we kept it as is, there would be, with the renewal, an increase of approximately $6,000 a month, and that is a lot of money. Overall. So it would basically, the library would be paying, as it stands right now, with the current people covered, over $51,000 a month for the cost. Now, some of that would be on the employee, but not many. You can see Ascenda put together this. The green one shows how it would be with the increase with the current plan. I also had her do, if we, I'm sorry, the green is what it is now.
Right.
Okay, the orange is the 14% increase with no change in the amount that the employee contributes. So that would still leave quite a bit of responsibility for the employer, about $531,000. If you look at the yellow, it's if we increase the employee contribution by 2.5%, which would be 10% for the employee and 35% for the family. It would raise the cost about $20 per pay, or is that per month, Dylan? Is that per month? Okay, per month. And a family about $61, but it would decrease the cost of the library to about $515,000. And the blue one shows if we increased it by 5%, so the employee would pay 12.5%, and family dependent coverage would go to 37.5%. And that would bring the library's cost down to about $500,000. Obviously, it does increase quite a bit the cost to the employee, but you know, these are times where you know insurance is just going to keep increasing.
Some people aren't even getting it.
And some people are not getting it. And you know, the other thing.
No, I mean out there in the community. I mean,
right.
Some people don't, they can't even get health insurance. So you know, this is actually a really good deal.
Right. One of the things that we are also suggesting, Acinda and I and Dylan, is what a lot of companies have done and places have done is that if your spouse can get insurance through their own employer, that they must take it and come off of ours. And also the possibility of next year of completely not covering spouses at all. One of the reasons that the top, and we don't know people's names at all, I mean, but 3 of the top heavy users were spouses.
Yeah.
So that's the problem that we're seeing. But
we just have to be careful to go from where we are now to change that. I'm not saying don't do it. I'm just saying consider the fact that it would not look good on us to do that. Now, if we know the spouses are needing it and we're taking it away, I'm just saying it's out there.
Well,
Does that make sense?
Right. Well, we were saying possibly this first year that if a spouse has it available through their own employer to take it through them, right? But
You
not
would phase it in.
Yeah, phase it in. Give people a full year to look to be finding another insurance coverage for their spouse. But no, we didn't want to take it away immediately. We wanted to phase it in. And if they have it through their own employer, they should be taking it because that's part of their benefit package.
Sure.
So,
They don't if it costs more and they can get it cheaper through us.
Sure.
right.
And
we
sometimes employers will pay a dividend to you for not taking the insurance.
Yep.
And so they'll take that and then get cheaper insurance with us, and we pay in the long run.
Yep.
Well, we're finding a lot of libraries are beginning to just say, you know what, we're going to determine how much we paid you for insurance. We're going to give you that in salary, and we are dropping all insurance coverage. Briggs Lawrence did that. A lot of libraries are no longer offering insurance of any kind. I don't know if I want to be that radical.
Even the renewal option number 3, the percentages that the employees have to pay are still very reasonable.
I agree.
As to what is out in the general, would you say 2, Ryan?
Yeah, you know what? Which option you talking about? 3?
Yeah, if you look at renewal option 3, the employee portion of that is still only 12.5% that they have to pay.
Yeah.
And then
that's
the employee and family only have to pay 37.5%. Like, to me, that still is very reasonable.
That family price of $723.24 is a really good price. Just saying.
Like,
you got to try to get an individual. Yeah, you got to try an individual, and it might cost, or a family, it might cost you $1,200.
Yeah.
Yeah, I'm just saying, whenever we did that, when Obamacare.
That we can't, next year, if things look better and the insurance coverage and premiums go down, we can't. But I still feel like that's a very reasonable.
Well, when Obamacare hit and they said, everything's going to get great, what happened was everybody that came to me, so State Farm dropped health insurance. We don't even we do certain things, but not major medical. We quit. And the biggest reason was because when they came out with Obamacare and everybody started coming in to try to get quotes and prices, the only people we could give it to were the ones that were getting it free already, and they got it free, and then everybody else that came in was like $1,200-1,300 a month for families, and they couldn't afford it.
Yeah.
So 720 and 723 is a pretty good price.
I think we certainly begin phasing in somehow that if your spouse has insurance at their employer, then you need to start taking that. And I agree that these rates are not that, the employee contribution is really not that bad.
I've got a family, my policy, Charles, through State Farm, my group one that I have through State Farm, I pay about $300 more a month than they do on my family policy.
Yeah.
Just to let you know,
Yeah.
Kara.
Yeah.
Yeah.
And that's a pretty good policy I got too. I don't know. Just to let you know, Kara.
So, Paige, this would be effective October 1, correct?
Correct.
That's a pretty good policy.
So whatever changes, we would say, like, as of October 1, if your spouse has insurance coverage somewhere else, they have to take it through them.
Correct.
Now, how do you
know?
sign something? Like, I feel like
How can you prove
I feel
it?
like the hospital and other employers have done this too. I feel like you have to have them sign something or provide something. I don't know. Is Ascenda there or?
No, but I believe you're right. You have to get have them sign a form off saying that their spouse has no other coverage, and
Tammy, do you think that's true? Is that what have you any experience with that?
I don't have any experience with it, but I do believe that's the protocol.
Okay.
We can always check with the hospital HR and see what their process was.
Hey, Paige, it's Ryan.
Cool thing.
Yeah, they did that with us just this year, Paige, for the first time. They made us verify our spouse. We had to verify that that they didn't have any other insurance, and we had to do that this year with State Farm. So I'm sure they're all doing that.
Yeah, I would say that Anthem probably has a pre-populated form that we could just pull down and
Yep.
send out to the
They
staff.
should.
Yep.
So I think we're in agreement that we all want to move forward with the spouse stipulation, but what about
for the first year, right? Like, if they have coverage, we're just going to say that amount right now, right, Jimmy?
right, as far as that, but then we
Yeah.
also still have to address the
Pick a plan.
right.
Yeah.
The plan we've been looking at is Plan 20, which is the plan we have right now. It's just with the 14% increase. So it is option 20.
Well, you say option 20, but it's still one of these choices, though.
Right, it's the Anthem Blue Access PPO option 20 with RX option 2T 12.0.
Okay, that's on a different sheet. Like, that's on the sheet that has all of them listed, and the one says current and the one says renewal.
Correct.
But then, did you prepare that spreadsheet then on the renewal amount, right?
Yes, so the spreadsheet is prepared on the renewal amount based on the orange portion of the spreadsheet is keeping the employer and employee contributions the same at 7.5 and 92.5% if they're on the just employee only plan, and then the
Okay.
employee contribution at 32.5 and the employer contribution at 67.5% for employee spouse, employee child, and family. And then the yellowish box increases the employee contribution to 10%, and increases the employee spouse, child, and family to 35%. And then the blue box increases the employee contribution to 12.5 and the family, child, and spouse coverage to 37.5.
Okay, Mr. Lee, sounds good, sir. Thank you for your patience.
So renewal option 1, 2, or 3 under the plan option 20, which is no change in plan. That's where we're looking right now. Is that correct?
Correct.
Correct.
And which renewal option are you all leaning toward under the plan option 20? 1, 2, or 3?
I would suggest 2 or 3.
Right.
That's what I'm kind of leaning toward, is 2 or 3, Tammy.
Okay.
My biggest concern is if you look at the current plan, and I know that Ryan said these premiums are still good premiums, but if you were to jump from the current plan to option 3, the family plan, that premium jumps over almost $200 a month. So that might be hard for some people to stomach. But again, like Ryan said, that is still...
That's what I was kind of leaning toward, is maybe you ease into it with option 2.
Yeah.
I think option 2 would be my preferred plan.
The
But I think we
majority
should-
of employees are covered under this year.
Right. If you look...
and that's not a huge jump. I mean,
20 bucks.
52 to
right.
20 bucks.
80, basically.
And that is split between 2 payroll deductions. So whatever the employee pays is split in half, per paycheck.
Yeah.
We could also have conversation that eventually we want to get to option 3, and so if that's what we want to do.
Right.
And so we phase that in. In other words, we gave them, what, a 3% raise, a 2% raise, and then we come back and take 2.5%, increase in insurance. I don't know what those numbers look like, but, am I making sense?
Right.
There goes the raise.
And we always have the
Maybe raise and then
option...
turn around and take it back in healthcare.
Right.
It's a raise, but it isn't a raise, you know what I mean?
We always have the option too to kind of split the difference a little bit more, like increase the employee portion, and then maybe, like for previous public employers that I've worked for, didn't really matter if it was employee or employee spouse or dependents, everybody paid the same percentage. So when I was at Lawrence County, everybody paid 20% of the premium regardless of the plan. So that could make it a little bit more fair between the plans, but again, that's something that we can discuss further along the road.
Yeah.
Do you know what they do at?
Really, 10% is not that high.
Right. So,
No,
and I think that's the thing is I see the dependents are paying 35%. If they have a child or a spouse or family are paying 35% of their contribution, and the employees singles are only paying 10%. So.
Well, actually, back in 2018, we did switch it up to 7.5%, and did increase it by 2.5. And then last year, we were supposed to move it up to 10%, but we did not. So we actually gave them an extra year at the same percent. So we had planned on moving them to the 10%.
We need to make sure we reiterate that, maybe let them know, remind them of what we did. That way they know we did help them out last year, maybe. I don't know.
Well,
really, we've been lucky because our rates have been we've been able to absorb it.
Right, they've been steady
But
over the past.
we had that issue several years ago where we ended up, having to implement some changes at that point. So it's definitely kind of comes and goes. And it's all based on the usage, but still,
Right.
Well, one thing I think our staff needs to look at too, every library system had to furlough their employees during COVID. We went 3 months with paying staff and they stayed at home. So, they weren't driving their cars in, they weren't using their clothes to So, I think that they need to work with us too in realizing that these costs are escalating out of control, and we need their help too. We did not furlough anyone, we did not lay off anyone through those really bad months, and most library systems did.
Right.
Yeah, I think we've been very generous, and what I think based on what I'm hearing, if we propose renewal option 2 under the plan option 20, which is 10% employee only and all other 35% contribution rate, and then add the stipulation that any spouse that has insurance available through their employer must take the insurance through their employer. I think that's a good first step this year, and then we can ease into perhaps option 3 next year.
Okay.
Sounded like a motion to me, Tammy.
Well,
There you go.
well, we have to break.
Can you repeat that, Tammy?
I agree with it.
Does anyone have a copy of the board minutes? We have to kind of break them out a little bit. So,
Oh, okay.
okay. So if I read it, I'll just kind of rephrase what you had, and then if Tammy, that's what you were making the motion for. So I've got Tammy moved to approve the renewal of health insurance with Anthem Blue Cross Blue Shield policy 20 with RX option T2 to begin October 1st, 2020. And so we would just need a second on that.
I'll second.
I'll second.
Okay.
Okay, Ralph seconded that, and then, can you call the roll, Dylan?
Yep. Mrs. Morton,
Yes.
Mrs. Tiemann,
Yes.
Mr. Sammons,
Yes.
Mr. Clay,
Yes.
Dr. Kemp.
Yes.
Okay, and
And then Tammy moves to approve the employee's responsibility for payment of health insurance premiums of 10% for single coverage for full-time employees and 35% for dependent coverage for full-time employees beginning October 1st, 2020.
Do I have a second?
I'll second. I'll second.
Seconded by
I think
Ralph.
that was Dr. Kemp, I believe, wasn't
Charles,
it?
yes.
Oh, sorry.
Charles.
Call the roll, please.
Mrs. Morton,
Yes.
Mrs. Tiemann,
Yes.
Mr. Sammons,
Yes.
Mr. Clay,
Yes.
Dr. Kemp.
Yes.
And then one more, Tammy, with the spouse coverage.
Oh, yes. So I move that to remove spousal coverage if the spouse can obtain health insurance through their employer.
Do we want to do that as of
So let me
September
ask you a question
30th?
with that.
As of
As of the end of
If
September?
if that takes place October 1st, are they able to get into, so if my spouse is working there and I'm covered on her plan, I get dropped off October 1st, am I able to pick up at my employer?
yes, that
Like,
is
most of
insurance
them
there.
are immediate, like especially if you have a change in coverage,
Right.
most of them are immediate.
It's
Right.
considered a
It's a
qualifying
qualifying
event.
event.
Yeah, qualifying event,
All right.
exactly.
yeah.
I
As
didn't
of
want to
September
leave
30th.
people out in the cold.
Right.
Right.
So Tammy, I would
I mean-
add to the end of that
Yeah.
motion as of September 30th, 2020.
Yes, add that.
Okay, so Tammy made the motion, do I have a second?
Ryan will second.
Okay?
Okay.
Can you call the roll, Dylan?
Yeah. Mrs. Morton,
Yes.
Mrs. Tiemann,
Yes.
Mr. Sammons,
Yes.
Mr. Clay,
Yes.
Dr. Kemp.
Yes.
Okay, we're not quite yet finished with the health insurance. Two other things. In order to help, believe it or not, to keep cost at even the 14%, it helps to have the high deductible. And so we have done that for years, the HRA, and we don't have tons of people use it, but it does help keep our cost lower. So I don't know, Tam, and then also the next one is to have people's insurance as the third-party administrator to administer the HRA. Do you want to go ahead and do those two also, Tammy? Okay.
I move to approve the HRA with the employee responsible for the first 1,000, the library responsible for the next 2,500, and then the employee pays the remaining 1,500 to meet Anthem's max out-of-pocket deductible of 5,000 per covered individual.
Do I have a second?
Ralph will second that.
Go ahead.
Okay.
Ralph?
Can you call the roll, Dylan?
Yes. Mrs. Morton,
Yes.
Mrs. Teeman,
Yes.
Mr. Sammons,
Yes.
Mr. Clay,
Yes.
Dr. Kemp.
Yes.
And finally, I move to approve People's Insurance as the third-party administrator to administer the HRA.
I'll second. It's Ryan.
Okay. Can you call the roll, Dylan?
Mrs. Morton,
Yes.
Mrs. Teeman,
Yes.
Mr. Sammons,
Yes.
Mr. Clay,
Yes.
Dr. Kemp.
Yes.
Okay, so the next item is property insurance. And Paige sent us some information on the Ohio plan. We've been with Cincinnati Insurance, but we did some comparisons, and the Ohio plan is for Ohio public employers, and they actually use 115 of the 251 public libraries in Ohio use this. And Paige has gotten several, responses from different directors that they're very pleased with it, and they've had a lot of savings. So she got a quote. It looks like for us, it would result in a savings of $10,000 a year annually. Wow. Plus, that's much higher coverage than what we have now. Did I cover all that, Paige?
Yes, we met with him this morning. Dylan, you've worked with them before too, right?
Yes, I worked with the Ohio plan when I was at the Village of Colgrove, as well as when I was with Lawrence County. So the good thing about the Ohio plan is the coverage is locked in. So let's say in 10 years from now, we were to, for some reason, move on to a different plan or be non-renewable. If there are any claims during the period when we were covered, the Ohio plan would still pay those out. So you have a history insurance. It's not just, too bad, so sad, the end of your coverage is now. They would go back and cover that. They also offer options for additional savings if you do a 3-year commitment. Obviously, that's not what we're looking at today, but down the road. And like was mentioned earlier, the coverage limits are higher, as well as they're per occurrence. So that maybe Ryan could explain that a little bit better than I can, but we're not going to max out after we've hit our umbrella limit. We're going to have a coverage limit per occurrence.
Well, it sure sounds good to me.
Yeah.
And I don't know if we mentioned that, the errors and omissions insurance is also a lot less. And is that the same coverage or for more coverage on that as well?
More coverage.
More coverage.
Yes, and
Okay.
it's much cheaper.
And it makes me feel, Dylan, you had experience working with them and didn't have any issues.
No, they were great. When I was at the Village, we had a pretty large claim where we had a fire truck that was needed to be repaired, and our premiums really didn't see that much of an increase, and they covered it, and it was very simple. They're easy to work with.
And easy to work with.
They only
Okay.
write policies for Ohio's public employers, so they're very
Okay.
knowledgeable when it comes to what we can and cannot do, what kind of coverage we need to have as far as a public employer.
And their local office is based out of Ironton. So, if we need help, it's not like we have to contact Columbus.
Okay. Does anyone have any issues with that, or do we need to, everybody feel comfortable with that?
Mm-hmm.
Yes.
Do I have a motion?
Sure, Tammy will move. Help me out with the dates on this, Dylan. I move to approve the property and vehicle insurance through the Ohio plan for the period of
September 4th, 2020 through September 4th, 2021.
Okay. In the amount of
$25,345.
okay.
Do I have a second?
Yeah, Ryan will second it.
Okay. Ryan, second. Any other discussion? Call the roll, please.
Mrs. Morton,
Yes.
Mrs. Teeman,
Yes.
Mr. Sammons,
Yes.
Mr. Clay. Mr. Clay?
Oh, yeah, yeah.
And
I
Dr.
can hear you.
That's okay. Dr. Kemp?
Yes.
Okay, the next item is grant. And I remember seeing that, I've just gotta get there.
We applied for a grant through the Foundation for Appalachian Ohio and in partnership with AEP Ohio. And, due to COVID, people are desperately trying to find Wi-Fi and free Wi-Fi. So we had already expanded 2 of our branches, but 2 of our other branches needed the equipment and expansion as well. So I had Becky apply for this, and we did get it, and it was in the amount of $3,778. And Dylan, correct me, we have to have them formally accept the monies, is that correct?
Yes, so we'll have to accept the money, and then if we plan on spending it, they'll have to appropriate it into the line item there that I established specifically so we can track this grant.
Do we need to do that in 2 separate motions?
Nope, it's all in one motion.
Okay.
Would you like me to read the
Do I have
motion?
Well, do I have that motion?
It's
accept
agenda
that,
item number
appropriate it?
9, if you can find your agenda sheet.
I'll move to approve accepting the drive-up Wi-Fi expansion grant from the Foundation of Appalachian Ohio and AEP Ohio in the amount of $3,778 and appropriate the $3,778 into the general fund account 101-00-5-5530, the Wi-Fi access grant.
What she said, I second it.
Seconded by
Good
Ryan.
job.
Like that. Yeah.
Okay.
Mrs.
I
Morton?
guess I need to call the roll
Oh,
on that,
sorry.
I think, to have dollars. So call the roll, please.
Okay, Mrs. Morton,
Yes.
Mrs. Teeman,
Yes.
Mr. Sammons,
Yes.
Mr. Clay,
Yes.
and Dr. Kemp.
Yes.
And the other grant, Paige, help me out, the CARES,
Right.
CARES.
It's a
one,
long
are
one.
we just trying to apply for that, or?
Yes, the reason normally if it's a grant and the library is not required to match it, we usually apply for it. But this is very different because this is a federal/state grant, and it is the Coronavirus Relief Fund specifically for libraries to purchase PPE or other equipment we might need for quarantining or other purposes. And the good thing is it can go back for any purchases we made through March 2020. So we'll be able to be reimbursed for some of these costs. But it is quite a bit of money. It is up to $25,000 per location. So if my math is correct, Dylan, it's a total of $125,000 that we can apply for. So because of that, and Dylan, correct me if I'm right, we're going to have to do special accounts for this money. Is that correct?
Yes, so what we'll do is once you guys, if you choose to approve to let us apply for it, we will apply, and then what we'll need to do is we will have to establish a separate special revenue fund at the next regular meeting so that we can track all the expenditures and the revenue in that particular fund. And we will also have to delineate line items for each branch. So to make sure that when the auditors come, they didn't see that we're spending $50,000 at Maine and lesser monies at the other branches. So I'll have that. If you move forward with this, we'll have all of that information. Hopefully should be ready by the next regular scheduled board meeting.
Sounds good.
Yeah.
So today, if you'd like us to try to apply for that money, then we just need to make someone needs to make a motion to allow me to apply for the funding from that Corona Relief Fund for all 5 locations, up to a maximum of $25,000 each.
I'll make that motion, Mrs. Rouse.
Do I have a second?
I'll second.
Okay, can you call the roll, please?
Yes. Mrs. Morton,
Yes.
Mrs. Teeman,
Yes.
Mr. Sammons,
Yes.
Mr. Clay,
Yes?
Dr. Kemp.
Yes.
I think that was all on grants, correct, Paige?
Yes.
Yes.
So next is the Scioto County Budget Commission. So we were notified that they want to have a meeting with us. I believe that's next week, right, Dylan? August 26th?
Yes, the 26th at 1 p.m. In a meeting room that's in the courthouse. Heather Cunningham, the deputy or the chief deputy auditor, sent me instructions. So whoever would like to attend, I'll send out an email the day before letting everybody know where that meeting room is.
But the gist of it is they're just asking us to maybe provide them with some more details on how we're planning, because we have a pretty good amount in our accounts, and they just kind of want to see what our plans are. Would you say that's accurate, Dylan?
Right. So basically, with governmental entities, they're going to see that we're not carrying over a large percentage of our operating budget. And each year we've kind of continued to build up a small cushion, bigger and bigger. So they're basically they're just wanting to know what we plan to use this money for. But as you can tell from this list of projects, nothing is cheap. And
Right,
most of these
exactly.
projects are going to be a considerable cost.
Yeah.
And
Yeah, and you know, I think we're very conservative, and that's a good thing, but we just want to make sure that, you know, that they're aware of all that as well. I think that's just, you know, just a matter of showing them what our plans are. And
Yeah, if we
Paige,
don't,
you and
then-
Dylan are for sure going to that meeting, correct?
yes.
Yes.
Okay.
And do we want to add training, leadership training to the 2020 project?
Yes, that would be a good thing to add to that future plan.
Okay. Or just staff training, I don't know, however you want to word it.
Professional development.
Yes.
maybe?
There you
And
go.
Tammy,
Oh, that's a fancy way to
I
say
know,
it.
There
right?
you go.
That's why he gets paid big bucks.
But I think,
Tammy, did you have anyone
to
in?
help you?
Right.
Tammy has had some experience in that, so I think Tammy could probably help get some numbers on that.
Yes.
Would that be fair, Tammy?
Yes.
Yes. Yeah, I was going to ask you. We've got some basic numbers, but you know more than we do. What and an idea of what you want us to do. So if you could just come up with a good guesstimate and email it to me, that would be great.
You got it.
All right. Wonderful.
Did anybody else have any
Okay,
questions
I don't-
about the Budget Commission?
Do we have any public comments?
Dylan just asked a question, didn't you, Dylan?
Oh, I just wanted to know if anybody else had any questions about the Budget Commission.
Oh, okay.
Oh,
I thought I heard
everyone's
someone say
good.
something, but
Oh, sorry. Okay, so
Okay.
we'll move on to public comment. Do we have any public comment?
No comments?
no comments.
No comment. Okay. So
Okay, do I have a motion to excuse absent board members?
This is Tammy, so moved.
I'll second.
Ryan will, go ahead, Charles.
Okay, Dr. Kemp seconded. All in favor, say aye.
Aye.
Opposed? Do you have anything else, Paige? Or
Uh,
Dylan?
I don't. Do
I
you
think
have
that's
anything else? If that wasn't enough, oh my.
Yeah. Hey, we did a pretty good job.
I'm impressed.
An hour?
I'm impressed. Yes.
Okay, do I have a motion to adjourn?
So moved.
So moved.
Dr. Kemp, I'll let you do that one, and Tammy, you second.
Okay.
Alright. All in favor?
Aye.
Aye.
I don't think anyone's opposed.
Thanks,
so.
Dylan.
All right, appreciate it, everybody.
Thanks.
Thanks, guys.
Thank you.
Thank
Have a
you.
good day.
Bye-bye.
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 Night.